Imagine this for a moment. You've been feeling tired for weeks. Your stomach feels unsettled. There's bloating, irregular stools, maybe even itching at night. You watched part 1 of this series and realized those 10 symptoms sounded uncomfortably familiar. And now the question becomes very real. If this is worms, what do I do next? Is it treatable? Can this actually go away? Today, in part 2, we're talking about management, treatment, and prevention of intestinal worm infections in a calm, practical, doctor-guided way. And yes, the good news is, most cases are very treatable. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, don't forget to subscribe to this channel for more simple, science-based, doctor-reviewed health videos that help you understand your body better every day. Now, let's start with the most important question: management and treatment. Think of intestinal worms like unwanted house guests. Some might leave on their own, but most will stay, multiply, and cause damage unless they're properly evicted. That's where prescription antiparasitic medicines come in. These medicines work in different ways. Some paralyze the worms so your body can flush them out. Some stop them from growing. Others kill the worms or their eggs directly. The exact medicine depends on which parasite you have and how severe your symptoms are. For example, a very common infection like pinworms, often seen in children, is usually treated with Pyrantel pamoate. Soil-transmitted worms, which people may pick up from contaminated soil or barefoot walking, are commonly treated with mebendazole or albendazole. Protozoal infections, which are microscopic parasites often spread through contaminated food or water, may require medicines like metronidazole, tinidazole, or TMP-SMX. Here's something reassuring. Some infections clear with just 1 dose of medicine. Others may need daily treatment for a few days, or sometimes a few weeks. In certain infections, like pinworms, the medicine is taken once, then repeated after a short gap to kill any newly hatched worms. That's why following your doctor's instructions exactly is crucial. When taken correctly, most people start feeling better once the parasites and their eggs are gone. Outlook and prognosis. So what should you expect after treatment? In most healthy people, medicines kill intestinal parasites quickly, and once the worms are gone, symptoms usually fade away. Energy slowly returns. Digestion settles. Sleep improves. That constant discomfort finally lifts. However, treatment can be more complex if someone has a weakened immune system or is pregnant. In those cases, doctors monitor closely to make sure the treatment is both safe and effective. The key message here is hope. These infections are unpleasant, but they are manageable and treatable. Prevention. Now let's talk about how to stop worms from coming back. The strongest protection against intestinal parasites is access to clean water and proper sanitation. But even at an individual level, simple daily habits make a huge difference. Imagine a parent preparing food after gardening without washing their hands, or a child playing barefoot in soil where animals roam freely. These everyday moments are how parasites quietly spread. Prevention starts with awareness. Drink clean, safe water. Avoid water from lakes, rivers, or ponds unless it's boiled or bottled. Wash your hands regularly, after using the toilet, before eating, after handling pets, and after changing diapers. In high-risk areas, avoid raw fruits and vegetables unless they're washed with clean water, peeled, or properly cooked. Wear shoes when walking outdoors, especially in soil. Gloves matter too if you're gardening or working with dirt. Cook meats thoroughly. Undercooked pork, beef, or freshwater fish can carry parasites that survive heat unless cooked properly. And yes, safe sex matters too. Using protection reduces the risk of transmission of certain parasites. Living with an intestinal parasite. If you're currently being treated, your body needs support while it heals. Stay hydrated. Watery diarrhea can drain fluids quickly, so drink clean water, broth, or oral rehydration solutions. Eat safely prepared food. If your stomach is upset, small meals are easier than large ones. Prevent reinfection. In some cases, like pinworms, this means daily showers and washing bed linens during treatment. In others, it means consistent hygiene, footwear, and environmental cleanliness. Medicines can clear the infection, but prevention keeps it from returning. When to see a doctor: if you have ongoing digestive symptoms, unexplained weight loss, itching around the anus, fatigue, or you've traveled to a high-risk region, don't ignore it. See your healthcare provider, and go to the emergency room if you develop signs of dehydration. Severe watery diarrhea, dizziness, confusion, very dark urine, or very little urine output, extreme fatigue. These are signals your body needs urgent care. A gentle but important reminder: most people get intestinal parasites by swallowing invisible eggs, often from contaminated hands, food, or surfaces. You can't see these eggs, you don't feel them, and that's exactly why they spread so easily. But awareness changes behavior. Hand washing suddenly matters more. Food safety becomes intentional. Barefoot walking feels like a risk, not a habit. And if infection happens, early treatment prevents long-term harm. This brings us to the next step. In Part 3, we'll talk about risk factors, causes, complications, and the most frequently asked questions about worm infestations, including myths, fears, and what people often get wrong. This script is written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist, diabetes and hormone specialist. Information collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you found this video helpful, please subscribe and share it, because awareness is the first step to healing.